Whether or not Colorado ends up with a COVID surge like we saw last fall is going to depend on human behavior, on people's choices. And that's often the hardest factor to predict. Our Anusha Roy talked with the people who are paid to make those predictions for Colorado.
Today's conversation centered around how to avoid a surge like last fall, and it's coming up because it's within the realm of possibility.
There are scenarios where we could see another peak in hospitalizations akin to what we had in December.
There are two main factors to watch here: vaccine uptake and how many people follow COVID precautions like masking and social distancing.
Then we can avoid, one of these peaks that I think none of us wants to see happen again.
So what would that take? The Colorado School of Public Health ran a model a few weeks ago.
If we can get to 80% of adults vaccinated and 70% of eligible teens vaccinated, we could ensure ourselves a much safer fall and a much more normal fall.
Since that modeling, vaccination rates plateaued or increased in some age groups, and the CDC issued mask guidance, but it would still require jumping from around 52% of 12 to 17-year-olds to 70% with at least one shot, and 73% of those 18 and older to 80% by Labor Day, 3 weeks from now.
You would need a real substantial push.
You think like you have nothing left, and then you just do it. And I feel like our healthcare workers are doing just that.
This time around, UC Health isn't just planning for COVID, but how to keep up with other care.
We can have COVID, which is potentially going to surge. And then on top of that, we're going to have potentially flu and other respiratory viruses as well. And so in our thinking, we're not just thinking COVID, we got to think sort of broadly.
And if Colorado stays on its current trajectory,
it might mean, disruption to education, disruption to workplaces.
So both experts say that increasing the vaccine uptake, it's possible, right? This time we've got the infrastructure and we can have the vaccine supply as well to give it out to thousands of people at a time. The question is, will people actually do this? And when I asked the School of Public Health if Delta has made modeling really difficult for them, Kyle, they said what's more difficult than modeling the virus is just modeling out what human behavior is going to be.
As it has been from the start of the pandemic. Anusha, thank you.